get up out of my bed because I do work late. The healthcare um, industry will have you up late hours, messing up your day. So before I get up and and go start my day, um, I just wanted to get over this one article here. The last video I made was based off of someone's personal experience dealing with pancreatic cancer. And hear from the horse's mouth who did the research, the Mayo Clinic. Um, we want to give credit to mayoclinic.org. And let's talk about pancreatic cancer in depth. So overview, what is pancreatic cancer? A Mayo Clinic expert explains. And there's a video right there. We can go back to the video later on at the end of this video. At the end of this video that we're going to be reading through, we can go back to this video at the end of the video, guys. This might be a lengthy video because I might have inputs. So feel free to skip through. So pancreatic cancer begins in the tissues of your pancreas, an organ in your abdomen that lies behind the lower part of your stomach. Your pancreas releases enzymes that aid digestion and produce hormones that help manage your blood sugar. And as you can see on the picture, it's showing you. Let me zoom in. You see the pancreas, you see the small intestine and all the other stuff. These are things that we need to get familiar with. Let me say, so when we feel pain, we can know how to identify it. And the gallbladder is over there on that side. Yeah. So, and this is why my videos are long. So several types of growth can occur in the pancreas, including cancerous and non-cancerous tumors. The most common type of cancer that forms in the pancreas begin in the cells that line the ducts that carry digestive enzymes out of the pancreas. Pancreatic ductal adenocarcinoma. Adenocarcinoma. I'm going to zoom in on this one here. Pancreatic cancer. You see the gallbladder. This is like a zoom up, close up version. Right? You see the liver, the pancreas, the small intestine, and the pancreatic tumor. That's where it will lie, right? And blocking the bloodstream, and that leads to the heart. Wow, my goodness. So pancreatic cancer is seldom detected at its early stages when it's most curable. You hear that? So it is very important, guys. If we out there are feeling pain, it doesn't matter what age you are, whether you're 20 to 50 or 60, 70, go and get tested. This is because it often doesn't cause symptoms until after it has spread to other organs. That's why it's unable to detect in early stages. This is why checkups are important, especially for men beginning at age 35. So pancreatic cancer treatment options are chosen based on the extent of the cancer. Options may include surgery, chemotherapy, radiation therapy, or combination of these stages. So symptoms. Signs and symptoms of pancreatic cancer often don't occur until the disease is advanced. They may include abdominal pain, that radiates to your back, loss of appetite or unintended weight loss, yellowing of your skin and the whites of your eyes, jaundice, light color stools, dark color urine, itchy skin, new diagnosis of diabetes or existing diabetes that's becoming more difficult to control, blood clots, and feeling fatigue. When to see a doctor. See a doctor if you experience any unexplained symptoms that worry you. Many other conditions can cause these symptoms, so your doctor may check for these conditions as well as for pancreatic cancer. So, causes. It is not clear what causes pancreatic cancer. Doctors have identified some factors that may increase the risk of this type of cancer, including smoking and having certain inherited gene mutations. Understanding your pancreas. Your pancreas is about 6 inches, 15 centimeters long, and looks something like a pear lying on its side. It releases secretes hormones. It releases hormones, including insulin, to help your body process sugar in the foods you eat. And it produces digestive juices to help your body digest food and absorb nutrients. So you see how important this part of our body is. How pancreatic cancer forms. Pancreatic cancer occurs when cells in your body, in your pancreas, develop changes in their DNA. A cell's DNA contains the instructions that tell a cell what to do. These mutations tell the cells to grow uncontrollably and to continue living after normal cells would die. These accumulating cells can form a tumor when left untreated. So, when left untreated, the pancreatic cancer cells can spread to nearby organs and blood vessels and to distant parts of the body. Most pancreatic cancer begins in cells that line the ducts of the pancreas. So this type of cancer is called pancreatic adenocarcinoma or pancreatic exocrine cancer. Less frequently, cancer can form in the hormone producing cells or the neuroendocrine cells of the pancreas. These types of cancer are called pancreatic neuroendocrine tumors. Islet cell tumors are pancreatic endocrine cancer. Endocrine cancers. Yeah, I'm fairly new to the healthcare field, guys. So forgive my pronunciation. I'm still trying to get it. So risk factors. Factors that may increase your risk of pancreatic cancer include smoking is number one. Wow. Diabetes. And black people and diabetes. We need to focus more on that joint. And not just black people, everybody. Regulate and concentrate. You see it? So chronic inflammation of the pancreas. Family history of genetic syndrome that can increase cancer risk include a BRCA2 gene mutation, Lynch syndrome, and family atypical melanoma, and that's FAMMM syndrome. Family history of pancreatic cancer, obesity, older age, as most people are diagnosed after age 65. That's when most people found out that they have the disease. A large study demonstrated that the combination of smoking, long-standing diabetes, and a poor diet increased the risk of pancreatic cancer beyond the risk of any one of these factors alone. Complications. As pancreatic cancer progresses, it can cause complications such as weight loss. I don't know. I think they cut off a bunch of words here. Maybe this was copied or something. But yeah, so another thing is jaundice. And jaundice, pancreatic cancer that blocks the liver's bile duct can cause jaundice. Signs include yellow skin and eyes, dark colored urine, and pale colored stools. Jaundice usually occurs without abdominal pain. I don't know why I always messed that word up. Your doctor may recommend that a plastic or metal tube be placed inside the bile duct to hold it open. This is done with the help of a procedure called endoscopic retrograde. Look on the word here, cholangiopancreatographic. Yo, somebody, hey, spell. Sorry. So during ERCP, an endoscope is passed down your throat, through your stomach, and into the upper part of your small intestine. A dye is then injected into the pancreatic and bile ducts through a small hollow tube catheter that's passed through the endoscope. Finally, images are taken of the ducts. So pain. A growing tumor may press on nerves in your abdomen, causing pain that can become severe. Pain medications can help you feel more comfortable. But it doesn't solve the problems, though. It helps you feel more comfortable. Treatments such as radiation and chemotherapy might help slow tumor growth and provide some pain relief. But it doesn't take away it just slow it down. In severe cases, your doctor might recommend a procedure to inject alcohol into the nerves that control pain in your abdomen. This procedure stops the nerves from sending pain signal to your brain. So bowel obstruction, pancreatic cancer that grows into or presses on the first part of the small intestine, can block the flow of digested food from your stomach into your intestines. Your doctor may recommend that a tube be placed in your small intestine to hold it open. In some situations, it might help to have surgery to place a temporary feeding tube or to attach your stomach to a lower point in your intestines that isn't blocked by cancer. So prevention. You may reduce your risk of pancreatic cancer if you stop smoking. If you smoke, try to stop. Talk to your doctor about strategies to help you stop, including support groups, medications, and nicotine replacement therapy. If you don't smoke, don't start. Maintain a healthy weight. If you are at a healthy weight, work to maintain it. If you need to lose weight, aim to slow, steady weight loss. 1 or 2 pounds, 0.5 to 1 kilogram, a week. Combine daily exercise with a diet rich in vegetables, fruits, and whole grains. Guys, make sure all of these vegetable fruits and grains are alkaline. Choose a healthy diet. A diet full of colorful fruits and vegetables and whole grains may help reduce your risk of cancer. Consider meeting with a genetic counselor if you have a family history of pancreatic cancer. He or she can review your family health history with you and determine whether you might benefit from a genetic test to understand your risk of pancreatic cancer or other cancers. So we want to give the shout out to the Mayo Clinic for providing this article for us. Great information. Thank you guys for tuning in. For all you that stick out to this video, stick with this video to the end of it. They give yourself a round of applause. Clap, 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 clap. Yeah, man. Thank you guys for sticking through. Thank you guys for your patience. Thank you, friends, for coming to class. Blam, blam. See you again on another one. I'm about to get up. It's 12 o'clock.